a certification in trauma. So I am a certified trauma therapist because that comes along with this work that we do. And I'm so glad that all of you are here today to listen to the presentation that I have on depression. We will be discussing the different types of depression because it's kind of varied, the symptoms, possible causes, risk factors, and some treatment information that I'm going to be sharing today. And this is a rather lengthy presentation, so I'm going to apologize up front that I might seem a little hurried. It's just because there's so much material that I have to cover today. So we'll go on ahead and get started with today's presentation. I do research for every presentation that I do, and oftentimes there is very little research out there available that is specific to American Indians in anything. And I highly encourage people to, if you're looking to go get a PhD, here's a perfect research topic for you. We need people. So I'm always encouraging others to pursue degrees to help our people and get more research out there. Depression and suicide are challenges that are faced by many American Indian populations. The Native American population suffers disproportionately at a rate 247% higher than the national average. So all races in the United States and across the country, for that matter, our depression rates are so much higher, and 427% higher than the national average. Northern Plains Indians of Indian Health Services and other public areas on reservations. So a lot of the data that I've collected comes from that information. For many of us that are working in the field, everybody wants to know, what do you use to make an assessment, to make a diagnosis, to determine? Not everybody can make a diagnosis, but those of you who are working with people, you can at least rule it out or support. I think this person needs to be looked at further because this instrument they scored pretty high on. One that the Indian Health Service uses, and I've just incorporated into our assessment process. So everybody that comes to the Crow Tribe's substance abuse program gets screened for depression up front. The Beck Depression Inventory can be easily found online for free. So if you want to look that up, you can find that. There is a Beck Hopelessness Scale. There is a couple of other scales here. If you use AccuCare, I know a lot of programs here in Montana and Wyoming. We all use AccuCare for our substance abuse assessments. So in there is a Mental Health 3. It's called Mental Health 3. That's a good screening tool. And there's also another substance abuse assessment. The acronym is PADDI, P-A-D-D-I, that not only looks at substance abuse issues, it also looks at any other mental health. It looks at depression, it looks at trauma, it looks at anxiety. But these are just a few tools that you can use to help you support a diagnosis or a referral and recommendation for further treatment. Next. Okay, there are several risk factors and protective factors among American Indians, and there is a 3-stage hierarchical regression to understanding the factors related to depressive and anxiety symptoms. So some demographics also include income. A lot of the research that I did on that is general research shows that socioeconomic status, people living in poverty are more at risk for depression. The ACEs is the adult childhood experiences, the adverse childhood experiences, and interpersonal violence. So when I was talking about tools, I also read, I think last week, that there are some therapists out there using the ACE study, the questionnaire, as one of their screening tools. So that's a good tool to use as well. And then looking at family resilience and family and community support. So those that have really good, strong bonding in their families, that support each other and help each other. And then I've read a lot of research that says even if you don't have that family, as long as you have one person that you can get support from that you need, is also a good protective factor to have. But in the research that I found was those that don't have, and this was prevalent among all races. It didn't just say Native Americans that don't have. So anybody out there that doesn't have strong family connection and support, that could be a risk factor. So some of the results of some of the research that I found also showed that many experience elevated levels of clinical significant symptoms of depression and anxiety. So about 15 and 20% of Plains Indians in one study showed that the depression rates were that high. So again, as I said, lower income is associated with higher depression and anxiety symptoms. Interpersonal violence, so any kind of abuse or crime, and the adverse childhood experiences variables are also positive association with anxiety and depression. So the higher the score is on the ACE, and the interpersonal violence issues tend to be more at risk for anxiety and depression. And these are the people that also come in to seek drug and alcohol treatment. A lot of times this is the reason why. It's very important that there is strong support for the role of family protective and promote family resilience factors to protect their family from anxiety and depression. Contrary to most models of intervention, instead of focusing on the individual, it is really important to promote the family resilience and family involvement. 9 times out of 10 where I'm working, families want to bring in their identified patient in their family as fix them. They have this problem and they have that problem. And then I'm like, are you willing, to look at what role you're playing in the situation this individual might be struggling with? And a lot of times I know a lot of clients will take that victim stance of, my mom keeps doing this, or my brother does this. So they're maybe having some issues within the family that's contributing to their depression. We can go to the next slide. American Indians and Alaska Natives, sorry for the typo there, tend to be exposed to trauma and violence at elevated rates. Psychological trauma also increases symptoms of depression and anxiety. There is a strong relationship between trauma, including interpersonal violence, and childhood trauma and depression and anxiety. So on that ACE questionnaire, even though it's referring to childhood experiences, if they check all those boxes, I'm one of those that actually could probably check all of those boxes, but that's when you need to look at, resiliency and building resiliency and self-esteem. American Indian women are much more likely than males to be exposed to trauma. That includes interpersonal violence and child maltreatment. 46%, that's almost half of American women and American Indian women and Alaska Native women report interpersonal violence victimization, which is the highest of all races. American Indian and Alaska Native children also have the highest rate of victimization. So as that ACE score increases, so does the likelihood of that individual struggling with depression, and that also makes them at risk for suicide and violence. We can go to the next slide. Those with higher income have lower depression scores. Family resilience and social support is negatively associated with depression and anxiety. Due to the historical oppression and poverty may place greater risk daily stress on American Indians and Alaska Natives with fewer financial resources to deal with stress. Not everybody seeks mental health treatment, especially those that are Native American. A strong family environment may provide the social support and warmth that enables the risk for depression to be minimized. So having those strong families Even though you might be a single family, if you look at your extended family for more support, is something you need to build upon. And capitalizing on family resilience and social support are promising. The research that I looked at shows that these tend to be a buffer against psychological trauma, the interpersonal violence, and the adverse childhood experiences, especially when we're looking at depression and anxiety. I'm all about prevention, so if we could do that on the front end, it will help tremendously. Family and tradition. Of course, families are an important source of support and strength that is highly beneficial for American Indian and Alaska Native populations. Practitioners can work to enhance family resilience as a sustainable source of strength, promote protective factors contained within the family resilience inventory, to strengthen and support pathways to resilience for all, and to respect and appreciate the American Indian and Alaskan Native collective resilience. So when we look at all that American Indians have been through throughout the years, we have to be one of the most resilient of all races that exist today. I was talking briefly with Megan before we got started, and we were talking about our role models in our families. You can go to the next slide. So the objectives that we'll go into next, we will look at the different types of depression and why a holistic preventive approach is important. And we will look at the effects of depression and identify some strategies that might be helpful for those of you that are actually treating people with depression right now. Next. We look at the symptoms of the flu. When we're not feeling well, we might be having a fever, our throat hurts, or we're having trouble with breathing, or we're having some congestion, especially now with COVID. I was talking to one of my staff yesterday, and they said, oh, we weren't feeling good, so we took COVID tests just to make sure it's not COVID. So any of these symptoms of flu, we're more likely to go get help for that than we are for our own mental health. Like, I don't think most of us even realize, I'm not feeling right. I'm feeling really down lately, and I don't know what it is. And I just think it's really important that we shouldn't have to wait until we get this bad, that we should be able to identify when we might be having a little bit of depression, because everybody at some point in time has ups and downs in their life. Mood swings are perfectly normal. A lot of times these are situational, based on specific circumstances that might be going on in your life. Yet sometimes these downtimes can become really chronic, severe, or debilitating. So it's very good, even if you're not doing this for yourself, checking for your other family members to make sure that they're taking care of themselves too. I just think if we took a more proactive approach to our mental health as well as our physical health, that a lot of people might get the help that they need that normally don't get the help that they need at all. You can go to the next slide. These are a list of several different types of depression. So there is the major depressive disorder, which can also include some psychotic features. There is also a persistent depressive disorder, also known as dysthymia. I've also heard of it recently being referred to as high functioning depression. So this are some people who may be going to work every day and meeting all of their responsibilities, but yet they have some of those underlying symptoms of depression, just kind of low level, but they're there if they take a good look at it. There's postpartum depression for women that have just given childbirth. And there is the premenstrual dysphoric disorder, which can cause depression based on the menstrual cycle. Depression and early recovery from addiction. So a lot of people that are in drug and alcohol treatment, and sometimes I tell them it's going to get worse before you actually feel better. So, be prepared for there's going to be some downtimes, and, what are some things we could do to help you not succumb to that depressive part. Bipolar depression, which is quite common in substance abuse that I've encountered a lot. So again, there's different types of bipolar depression, and this is where they experience major highs and lows. And of course, that requires oftentimes medical treatment. And then we have the seasonal affective disorder, also known as SAD. And I think the first time I heard about this was one of my instructors who taught me in my counseling program about this problem. And I was like, I didn't know there was such a thing then. I believe I was getting my master's degree then. And he had shared with us his wife had the seasonal affective disorder and had to have special, and that was part of the reason they ended up moving, because Wyoming is a lot like Montana. We have winter for about half the year oftentimes. And then grief, loss of a relationship, or loss of someone through death. It is normal for people to have grieving, but it's also good to pay attention to those that might be having a much more difficult time than some other people. There's situational depression, and just like I was telling you, we all have those ups and downs in our life, because depression does affect 22 million adults each year. So that's about 9% of the entire population. And depression due to general medical conditions, autoimmune issues, stroke, heart attacks, dementia. I've had people with diabetes that get depression because they also lose the lifestyle of eating whatever they wanted and have certain, dietary restrictions. So for some people, any health issue can cause them to have some depression, which can be expected. You can go to the next slide. And then we're going to go on to the PACER effects. And this is an acronym for dealing with depression and how we can look at depression. So depression can affect your physical health. So the P in PACER is looking at the physical health. Depression can affect your sleep. It can cause changes in the circadian rhythms, which further alter the balance and timing of neurotransmitter release. So most of us actually need to get our sleep every night, because that it does reset your brain for the day. And most of us work during the day, but then there's people who do a lot of shift work, and that can affect their sleeping patterns. And some people just have sleep problems. Depression can affect your appetite. Poor nutrition can affect your mental health. So when they say you eat crap, you can feel like crap, it's really true. And if you eat healthy and eat good, you'll feel a lot better. Some people increase consumption to stimulants just to cope with fatigue, and I can be guilty of that. I love my coffee, can't function without it. I think I tell myself that. Depression can cause you to be fatigued. You can feel tired. It can interfere with your ability to work, and also interfere with your daily activities of living. You can go to the next slide. The A is for affect. This is talking about your feelings. People with depression can be feeling guilty. They can feel worthless, which can compound the depression, make it feel more intense and worse. They may have a lack of interest in things that they normally enjoyed. Their cognition can be affected, which can make their ability to concentrate difficult. So I know one of the questions on the PHQ-9 asks them, do you have difficulty concentrating? Like, is watching TV or just trying to read something difficult for you to do? Depression can affect your self-esteem due to internal criticism, increase attention to negative stimuli and thoughts. So you may just have a whole negative outlook. And some people can be even so depressed that they can harm themselves. So if anyone's doing any self-injury, that's a red flag for depression and suicidal thoughts. Looking at the environment, some may stay inside, some don't even want to go out of their house. Oftentimes they stay in bed or stay in the dark, and they may feel disorganized. just an overwhelming feeling of not being happy at all. And we could go to the next slide. Looking at relationships, attachment difficulties. So there may be consistency to withdrawal from others and go into isolation. Their responsiveness may be affected. They might not be able to be emotionally available to other people. They may have difficulty, paying attention to others, not validating others, be irritable, not being empathetic with others, and not be supportive to people. So depression can really affect your relationships. You can go to the next slide. So when we look at your physical, it's good after you're working with someone to look at all the physical things that they could be doing for themselves, to be making sure that they're taking good self-care and for yourself too. So are they getting enough water? Are they getting enough food to eat? People can't think or do anything very well without having some proper nutrition. Looking at their breathing, they can do some, I've heard it called box breathing, where they have so many counts of breathing in, holding it, breathing it out. Being able to move, get some movement, get some exercise, rebalancing those circadian rhythms by setting a schedule. Like I have migraines, so I have to make sure I get my sleep. I realize that sleep is one of my big triggers. So it's really important that you pay attention to your having a regular sleep schedule. Some people need light therapy. Those that have depression, there is research, especially for those with SAD, that there are these little lights that emit intense light, and they're just small little lights. You can buy these from Amazon for like $20 if you think you need them or know somebody that might need them. And then your sleep hygiene, having rituals for going to sleep, maybe fixing your bedroom so it's a place where you associate with going to sleep. Ruling out or addressing thyroid or hormone imbalances, vitamin deficiencies. So this might be something where you would go get a physical, maybe have them run some blood work and rule those things out that might be medical problems. And to just pace yourself, take your time, taking care of yourself. For some people that are having depression, you don't have to, accomplish a whole bunch of things in one day. Maybe it's just as simple as doing one thing in one day and being able to be glad that you were able to accomplish one thing. For one example, I think I had somebody, they talked about their house being overwhelming and what could they do, and I was like, well, rather than think you have to do it all at once, what one thing could you do like one day? And I think the one thing they picked was cleaning their refrigerator one day. So they were like feeling so happy that they actually got their refrigerator organized. So it's just little things like that that can help their environment. We can go to the next slide. And affective, some good interventions you can do for yourself is add in something that makes you happy for about 10 minutes, about 2 times a day. I like cats. I like animals. Some people like comedy. Some people make playlists. I have a really good friend who's always making playlists for going to the gym or playlists that inspire her. You can look at developing distress tolerance skills. And so there's another acronym here called CATS. So making comparisons of some things that you've done when you weren't feeling good. Like, so when you normally don't feel good, what did you do? What have you done before that you could do differently? Having some activities to do, anything to distract you, anything to get you moving. Some people can do coloring, doing some kind of crafts that they like to do. Okay. The cognitive part, identify and address core beliefs that are contributing to hopelessness and helpless, anything that might be making that person feel unsafe. Use reasoning that is focused on facts and probability. Focus on the positive for 20 minutes a day. Gratitude journals are really good. If they can pick 3 things that they're thankful for, that they're grateful for in life. That could be as simple as having just being able to have some water, for example, or that we're alive that day. So looking for the little things to be grateful for and reflecting on those, focusing on the positive, mindfulness, practicing mindfulness to tame the monkey mind. So a lot of people I know, one thing I learned was the cell phones and the screens on the computer, the TV, all of that can affect your brain when you're ready to go to bed. So if you can eliminate those, that will also help you to get some sleep. Identifying parts of a situation that are within your control. One of the things that I learned from one of my instructors several years ago, and I use it to this very day, is I have that in quotes there, the parentheses, the egg diagram. And that's just basically drawing an egg on a piece of paper. And in that yolk of that egg is being able to focus on the things that you actually have control over. Like you get to decide what clothes you're going to wear, if you're going to go to work that day, what you're going to, spend money on, or what you're going to eat. Some of the things you have control over. And then the white part of that egg would be the parts that these are things that we don't have control over. I can't control the weather. That's just something that's out of my reach. So looking at what we realistically have control over and telling people, when you're having a bad moment, to be, accept it non-judgmentally. Like I said, we all have moments in our life where, some things are very challenging for us. So what can you do to improve the next moment? And I like to remind people when they're saying, I'm just having a bad day. I'm like, don't let one little thing ruin the rest of your day. Hope the rest of your day is better. Don't let, one bad thing bring you down. We can go to the next slide. Environmentally. One thing that really helps is to make it bright during the day and dark at night. I'm one of those. I'm at home as soon as it's daylight and the sun is out, I'm opening all the curtains and making it bright in the house. Telling people simple things as just taking a shower and getting dressed, getting out of bed, preferably to get out of the house. Essential oils are also really popular. And here is a list of different kinds. The lavender is really good for helping to sleep. Cinnamon, basil, citronella, the citrus fruits, peppermint, rosemary, sage. And then for those people, we're native, and some of the best smells I love are sweetgrass. We burn cedar, sage, that we use those for smudging. Those are really good for calming and for helping. So we use those often. Those are our native ways that we use. Relationally, you want to help your loved ones understand what's going on and how they can help and encourage you. Maybe they need to call a friend, or interaction with other people is really helpful for people that are depression, because like I said, they tend to isolate and want to be alone. So I always encourage them to find ways to interact with others, and don't assume you know how others are thinking and feeling about you. When you look at that word assume, it makes an ass out of you and me when you assume. So it's always good to let people know. So if you're feeling down or your clients are feeling down, encourage them to let someone know. I have them do a safety plan in our very first session, and that is to find people for support. Give me 3 people you can call, and oftentimes, they'll ask me, can I call you? And I'm like, well, we have an on-call number, so if you do need me, you can call that number. Ask yourself what you would do for someone else who's having this problem. So you might ask them, what would you do if your friend was having the same problem? So those are the things you can do to help someone. And always think before you speak. Is it true? Is it helpful? Is it inspiring? Is it necessary? And is it kind? And look for what you can contribute to help that person that needs help. So just to summarize this first part, as you've seen here, depression has a lot of causes and consequences. It is necessary to address all the issues that could be contributing to these neurochemical imbalances, including your physical things, hormones, pain, malnutrition, exhaustion, anything that's not, causing you to have enough happiness and emotional dysregulation, cognitive issues like unhelpful thinking styles. A lot of times it's thinking patterns that need to be evaluated. Looking at the environment, is there anything that's contributing to the stress? Looking at that home environment. Some people that come seeking treatment don't even have a sober home to go to. So sometimes we have to find places for them to go. They may be in a toxic relationship, maybe living unstable. Maybe they don't even have a place to live. So being able to know what your resources are in your community is very important. Next slide. Okay, next we'll go to the biopsychosocial impact of depression and some strategies to prevent and do some intervention. To the next slide. So the objectives in this second half is defining depression, exploring the biopsychosocial impact, learning how to ask strength-based questions, assessment questions, and identifying some causes and looking for some activities and interventions that might help people. The next slide. So when we're looking at depression, it represents a whole cluster of symptoms. Like I shared with you earlier, when we look at the flu, that whole list of symptoms that you can have when you're physically ill. Diagnosis with depression only requires people to have a few of these symptoms for at least a couple of weeks. So a variety of different things can cause or be caused by depression. Your emotions, there could be anger, anxiety, guilt, grief, shame. Women are much more likely to admit depression. And when we look at the statistics, about 20% of women struggle with depression and 10% of men struggle with depression. And these are mostly the middle-aged adults from age 18 to 34. So overall, about 9.8% of the whole United States population. And people of color are more likely to struggle with depression than people that are Caucasian. And that age range from 18 to 34, that middle age, suicide is the second leading cause of death. About 47,000 people die by suicide every year. And so when I'm looking at someone who's suicidal, they have severe depression and that needs to be treated. So we also need to look at their thoughts, those cognitive distortions, like I was telling you, I call them thinking errors, relationships, poor self-esteem, unhealthy, unsupportive relationships, and they have the strong need for some external validation. Physical problems, neurochemical imbalances. Some people, not all, do actually have neurochemical imbalances, and they may require some medication, some temporarily and some depending on the severity of the depression. Looking at the nutrition, are they eating healthy? Are they tired? Are they sleeping well? And some medications can have side effects that can cause some depressive-like symptoms. And looking at the environment. So the environment, high stress environments, affects anyone's ability to relax, their ability to rest. They may feel more hopeless than helpless. Change to the next slide. What is recommended is a strength-based assessment. So these are some questions that you could ask someone, asking them, what does this mean to you? Define depression to me. What does that mean to you? And these are some words that they might be able to relate to. What symptoms are most bothersome for you and why? So for each symptom, get a little tongue twisted sometimes. What makes it worse? What makes it better? So if they realize there's some things that are actually helping them, let's do more of those. How can we do more of that? And how can we avoid some of the things that are triggering you to feel worse? How was life more pleasurable prior to getting depressed? So what were things like before you realized you're depressed, what's different during the times when you're not depressed. So being able to look for those exceptions to point out, so you're not depressed all the time. And how do you expect life to be different when your depression is gone? So who's going to notice that? The next slide. The neurotransmitter imbalances, the ability to feel, affects your ability to feel pleasure. They may have emotional flatness, have some memory issues, difficulty concentrating. Yesterday, I had somebody who was literally, I think, falling asleep in the chair during the assessment, and I really had to point that out to them. And what they said to me was they were having some health issues. So, you know, one of the things I recommended before they left was you really need to get to the doctor, because if you're saying it's the health issues that are making you feel really sleepy, because this is looking like depression. Lack of motivation, fatigue, pain, irritability, agitation, the fight or flight stress symptoms. Those are the neurotransmitter imbalances. They need to get quality sleep. Like I said, create a routine. Some people can't sleep because they're having pain. So learning how to manage pain, preferably without using any medications. And some people have sleep apnea that affects their sleep. So again, this requires medical attention, medical care. We need to work on improving their sleep environment. Like I said, shift work can affect that, time zones, daylight savings time. Relaxation, it's important that they do some relaxing. Biofeedback, some people can actually use your smartwatches now, and if you wear them to sleep, it can actually tell you, you know, the kind of, if you're getting good sleep or not. Practicing progressive muscular relaxation. YouTube has a lot of awesome videos for that, free, that you can find. And we also need to look at medications side effects. Psychotropics and opioids can, you know, they can make these things worse, or if they have to be taken, need to be monitored carefully. We want to focus on nutrition, improve your healthy diet, address addictive behaviors. Using substances makes it worse. Drugs and alcohol can be the cause of depression, or be an effect of depression. I tell people, you know, using any substances is going to make it worse. Opiates contribute to about 70% of overdose deaths. We need to address the addictive behaviors, and there's not just substance use behaviors. There are addictive behaviors, also known as process addictions. You know, those can be gambling, those can be shopping, they can be gaming, being on the internet. Address chronic and extreme stress. So as a refresher, both of these increase the amount of transmitters flooding the synapses. To protect your body from overload, the brain will shut down some of the receptors so the body does not overload. And when the neurotransmitters return to normal level, the receptors are still shut down, so not enough of it is getting out. These are your dopamine and your serotonin and the endorphins. So these levels can be off. Things that normally cause a reaction no longer are strong enough to cause a reaction. We can go to the next slide. Again, we have to look at the thyroid. These can be altered in response to stress, which will impact your mood, libido, and your energy levels. Estrogen boosts neurotransmitters that affect your sleep, mood, and memory. Affects your pain perception, your learning, and your attention span. Increased estrogen may increase the availability of serotonin. Testosterone levels, low testosterone can be implicated in reducing the availability of serotonin. Testosterone is produced by the adrenal glands, and testosterone improves stamina, sleep, assists with brain functioning, and most men are less likely to express depression at all. Their Depression could be expressed as anger or irritability, and I think that puts them more at risk of using drugs and alcohol. And I think they mask depression because of stereotypes of being a man. I know in the Latino population, it's the machismo. And if we look at the suicide statistics, men are 4 times more likely to commit suicide than women. So I think that says a lot there, that we need to take a closer look at the males that we're treating. The next slide. More on the hormones. The cortisol is made by the adrenal glands, and stress can cause this to be too much. It helps the body adapt to stress by increasing the heart rate, increases respiration and blood pressure. Cortisol levels increase early in the morning to prepare for the demands of the day, and decreases throughout the day, also known as our circadian rhythms. And insufficient cortisol can lead to heart problems and blood pressure reduction, as well as reductions in energy and motivation. DHEA levels decrease as we age, and this can also increase libido and sexual arousal. It improves motivation, engenders a sense of well-being. It helps decrease pain, facilitates rapid eye movement, so it helps with sleep, and enhances memory and enhances the immune system. Go to the next slide. To maintain a healthy level of your hormones, you need to have, get a physical, get some blood work done. I use my birthday as, it's time to go get a physical and make sure things are going good. I have risk factors for health problems in my family, so I like to keep an eye on those to address what might be causing any imbalances. A low glycemic diet, watching the sugar. The less sleep you get, the higher your cortisol will be. So the more sleep you get, the lower it will be. So it's very important to get at least 6 hours of sleep each night if you can. More on hormones. Final thoughts on hormonal imbalances that can affect millions of people. That can include feelings of anxiousness, being tired, gaining and losing weight, not sleeping, changes in sex drive, focus, and appetite. Causes for hormonal imbalances include poor gut health, it's your diet and what you're eating, inflammation, high amounts of stress and depression, genetic susceptibility. Some of us, inherit some of these problems, and toxicity. Natural treatments include eating an anti-inflammatory diet, getting enough omega-3s, getting good sleep, getting some exercise, and learning to control stress. And then there's a link there that talks about balancing hormones if you're interested in that. The next slide. Looking at pain. Low serotonin is also associated with increased pain. Like I said, a lot of people are more willing to say they're, having pain than they are to say they're feeling depressed. So depression can contribute to muscle tension, as well as stiffness and achiness. Some interventions for that are getting enough exercise, and it doesn't have to be intense physical exercise. I tell people all the time, even if you spend, a couple times a day taking a 10-15 minute walk, that will be helpful. Using guided imagery, learning to practice muscle relaxation, having an alternate focus of the pain, TENS therapy. Those are these pain units that you can attach to your body. I haven't actually priced those, but when I've gone to physical therapy, those are really good for pain. Hydrotherapy is like using water massage, ice and heat, and ice is really a good pain reliever. And for some hypnosis, I've never tried it, but research tends to highlight that quite often. The next slide, looking at our emotions that can contribute to depression: anger, resentment, jealousy, envy, and guilt. Anger is half of the fight or flight. It pushes people away. for those that want to assert dominance and control. Excessive anger can lead to depression when it exhausts the stress response system, contributes to negative cognitions, and it impairs relationships. So some people that, have some anger issues, it really might be having some depression. It's just they're exhibiting it differently than we would expect. Next. Jealousy and envy can be thought of as anger at someone else for having something they wanted, having anger at themselves for not having it, existential anger for the universe at not being fair. Jealousy can contribute to feelings of hopelessness and helplessness. So some activities they could do is, let's make a list of some of the people that you envy or you're jealous of them. Identify why you are jealous of them. What way are they better off than you because of those things? And how does envy and jealousy affect your ability to live a rich and meaningful life? And what is a more productive way to use this energy? So it's just looking at some of those thought patterns that some people are exhibiting. Guilt can be thought of as shame, embarrassment, or self-anger for something you did or should have done. Some people have difficulty letting go of guilt because they think they deserve to suffer, or they may, if they forgive themselves, they might do it again. I think a good example of this is, some people call it survivor's guilt. Maybe, some tragic incident happened and they weren't able to protect someone. So some people could, have severe depression as a result of that and blaming themselves for something that, they probably really had no control over. The next slide. An activity you could do with them would be to make a list of things you feel guilty about, also known as a fearless moral inventory. How could you make amends? What did you learn from it? And how can you forgive yourself? And what can you do to just let it go? And forgiveness. So what does forgiveness mean to you? How does the concept of forgiveness make you feel? What does the phrase forgive, what does it mean for you? And forgiveness fire activity. So being able to take that forgiveness and putting it on a piece of paper and having a fireplace or even a fire outside and being able to crumple it up and throw it in there and let's burn it up and let it go away. Next slide. This is another activity you can do as a group or with a one-on-one. When you are angry, what do you notice is different about you? What are your triggers? What do those triggers make you feel? Do they make you feel, how do they make you vulnerable? Is it an external threat? Is it an internal threat? Is this a current threat or something from your past? And does this threat keep you from living a rich, meaningful life? How can you address each trigger to feel safer and empowered? Next slide. I'm looking at the time and I'm hoping we can get through all of this. Some other emotions is anxiety, which is the other half of fight or flight. Chronic anxiety, worry, and stress can exhaust your response system, affecting your neurochemicals and hormonals to increase tension and pain, causes the body to adapt to excessive stress chemicals by shutting down. Anxiety makes it harder to sleep, so they can be exhausted, and also those hormonal imbalances. Go to the next slide. To work with the anxiety, an activity would be for each of the following fears, identify 3 situations in which you experience it. So what are some situations you've experienced rejection and isolation, where you feel like a failure, loss of control? Is there anything unknown? So when you explore those situations that trigger, let's brainstorm some ways that you can deal with them, such as doing some fact checking, using some guided imagery, and dialectics to see it as a challenge, like create some challenges for them that are attainable, that they can overcome on their own. Grief is also sadness and depression. as a result of loss. And it doesn't, like I said, it doesn't have to be the death of someone. It could be loss of your home, loss of a relationship, loss of a pet. The grief process itself involves anger, sometimes at the self, other people, depression, helplessness to change the situation, and hopelessness and loss. Like I said, not just about death. The next slide, there is some activity. Got just a few minutes left. Identifying the loss, looking at physical abilities. Some people, their loss of their health, property, and just giving yourself permission that it's a normal part of life. We can go on ahead and jump to the next slide. I'm sorry, guys, we're running short on time. But you'll get these slides, so you'll be able to go through them and read all of the activities that are listed here. And oftentimes, I just get on the internet and start searching for resources that I can use. So here's some activities for grief, narrative therapy, making some crafts. Art therapy is really healing. Music, one of the things we recently started doing at our program is doing native crafts. We're doing beadwork, and we're having them bring their families in. So instead of just the patients, we're saying, bring your wife, bring your kids. This isn't just for you. You guys can participate as a family. To the next slide. Looking at happiness. Sorry, we're running out of time, but one of the things I like to do for myself, because I too have moments at time where I'm not so happy, and I love comedy. I love watching funny movies, and I have some favorites that I like to watch that I'll watch again and again. Exercise is probably the best thing you can do for depression, period. It's something that I recommend to everyone. And just looking at anything you can do to increase happiness in your life, things that, you can suggest to people, or having them come up with some things. And right now we are probably on the last minute. Like I said, you'll get these slides so you can read through the rest of this. I apologize. This presentation here was made to go for like a little bit longer than the time we have to cover today. But I hope I was able to give you some valuable information that you found very helpful. And on the very last slide, I think there is my email there for you guys to reach out and connect with me if you'd like. And thank you for being here. It lets me know you guys care about your work and the people that you're helping. And
Thank you,
really appreciate it.
Thank you very much. Like she said, you will get the PDF version of this in your follow-up email because you registered. So we have your email. No worries there. And if you have any questions, feel free to reach out to myself or Avis. I'm going to put the evaluation in the chat here momentarily, but it will come to you in the follow-up email as well. So please take a moment, just fill it out. It takes about 2 minutes, and it's how we keep providing awesome webinars such as these, free of charge, and it satisfies our funders. So we thank you, Avis. That was wonderful. Lots of information in a small amount of time. You did great. So with our next webinar, which will be, I believe, March 8th, we will talk about topics of I can't remember the title at the moment, but it'll be Jason Butler that we're going to feature next month. So check us out on our website. And if you have any questions, let me know. Thanks a lot, you guys, for attending. Have a great rest of your day.